with the understanding of supraspinatus tendinitis and its causative factor. Now, in this video, we will understand about the importance of understanding the painful arc syndrome with the relation of supraspinatus tendinitis. First, we need to understand that painful arc syndrome, it is a type of symptoms which occurs mostly any type of shoulder joint pathological condition, mostly the soft tissue injuries. Today we'll understand from this video during supraspinatus tendinitis what happens of the painful arc syndrome. Come, let us see the arc of the painful, what happens during a 180 degrees of abducted position. So first we need to understand that in a painful arc position, if I just draw the painful arc, consider this is the 0 degrees of abduction position, this is 90 degrees of abduction position, and this is 180 degrees of abduction position. So from in this 0, 180 and 90 degrees of abduction position, during the supraspinatus tendinitis, when someone lift the hand from 0 to 10 degree, within this range the patient used to have a pain, and again from 90 to 110 degree, during the time they used to lift the hand, they used to have a pain. So again, during the painful arc 0 to 10, during the supraspinatus tendinitis, they used to have a pain, and again from 90 to 110 degree, within this arc the patient used to have a pain. So with this easy understanding, we can tell that the painful arc is mostly positive when there is a supraspinatus tendon pain during this. The reason we know, during the glenohumeral abduction, the initiation of the range it's mostly occur by the supraspinatus muscle, and at 90 degree to 110 degrees of abduction position, this movement the supraspinatus muscle is to be taught during to hold the head of the humerus and the weight of the whole arm in this position. This is the two region where they used to have a pain, and if there is a supraspinatus tendinitis and a resultant causative factor, they used to have a weakness and pain mostly in these two regions. With this we can understand that the patient might have a supraspinatus tendinitis, but to confirm the exact diagnosis, we are having a few type of special tests. In the next video, I will show you which all of the special tests are indicated to diagnose the supraspinatus tendinitis. And if there is a injury level is bit high, if there is a chance of having a rupture, we should go for the MRI. But there is a lot of highly sensitive special tests which can diagnose the supraspinatus tendinitis. I hope people understand with the simple diagram of a painful arc where within a 0 to 10 degree and 90 to 100 degree the supraspinatus tendon used to work, and those who are having a pain, they used to have this pathology. But remember, this arc it's act as a red flag if the patients have a tremendous pain within the first few days of acute injury. Any sort of pain, it can be traumatic, it can be a repetitive traumatic. If the patient is having a red flag signal, any painful arc, it will give you the false negative report. That is the reason when the acute symptoms it's gone, then the time we used to do this painful arc and we get the proper report. With this, in the next class, I will show you which all are the special tests indicated for the supraspinatus tendinitis and which all other examinations it's mostly indicated to diagnose the supraspinatus tendinitis. Also, apart from this, we used to do the resisted isometric testing within this particular range, and the resisted isometric testing used to be positive whenever the person is having a supraspinatus tendinitis of this. Next video, I will show you what is exactly the resisted isometric testing is and how to perform the resisted isometric testing. Where to perform the resisted isometric testing, is it in a 0 degrees of abduction position or where the supraspinatus muscle is to work more. That's all learning will be in the next video. Till then, be with us. Don't forget to like this video and don't forget to subscribe our channel so that I can teach you most amount of orthopedic condition and related assessment regarding it. Thank you.